I now have the pleasure of welcoming to the dais Dr. Shivkumar Utture, President, Maharashtra Medical Council, for the keynote address titled India's Healthcare Ecosystem, a Catalyst for Transformation. Please greet him with a generous round of applause as he makes his way to the dais.
Thank you. Good morning, everybody. So today's guest of honor, Mr. Sona, the Secretary of Health, a very, very important post, especially what I'm going to talk about for the future as far as the health sector is concerned. So let me thank the organizers of Economic Times for having invited me here today for this very, very important talk, because today, as we know, the whole sector is at a cusp. In India, we are ready to launch the whole health sector, I would say. What we have been doing for the last few decades was what was learned in the past, but now is the time where we think about something different which is going to be. So just in short, I'll tell you what is the present scenario as far as health sector is concerned. All of us are aware that the health budget in India, unfortunately, is abysmally low as compared to any other countries, even our neighboring countries. And this has been the problem for, the basic health sector, especially the public sector for, not moving forwards. And it was during this COVID times that it taught us how badly we were prepared for something which hit us so badly during the COVID times. I'm not going to go into the details, but as you know, not only the budgeting is bad, but even if you see the private sector, almost 65 to 70% the private sector caters to of the population, whereas hardly 30-35% is by the public sector. And the out-of-pocket expenses of patients goes on increasing day by day. Not only that, if you see the hospital bed population also, if you see as compared to the rural and the urban areas is concerned, majority percentage is in the urban areas, whereas the majority population today, as you know, is staying in the rural areas. So something has to be done as far as that is concerned. Even if you see the manpower, health sector manpower, if you see, there is gross differentiation between what is there in the rural sector and the health sector. And basically, what needs to be done is we require the health budget to be increased. We require, as Mr. Sona has already said, accessibility and affordability are the two key words as far as, the Indian population is concerned. Health budget is limited, so the only other way that we can really be affordable and accessible is what he spoke about, is going for the digital era. And that is what today India is going to do. But at the same time, we do require the government sector or the public sector to invest more and more, especially in the health sector, and increasing the manpower as far as health sector is concerned. And even WHO says that at least 1.8 million doctors per 10,000 population India has to achieve by 2030. So for that, definitely we require a huge population of healthcare providers who should be there as far as India is concerned. And this is the vision, I think, of everybody. Though many a times this has been spoken about, have we truly achieved this universal healthcare as far as India is concerned? I would definitely say no. We have a long way to go as far as universal healthcare is concerned. Right to health, I think, must be made a right, as we say in right to education, which has already come into play. And there is a role of the private sector and the public sector also. And unless, and this is what COVID also taught us, that it was only in the initial phases, it was only the public sector which worked as far as COVID is concerned during the first wave, beginning of the first wave. And then the private sector joined it. And when these two sectors joined together, that was a time when we could really, cater to the huge population which was suffering from COVID. And we could get, and today, as you know, like in Mumbai, we are hardly seeing 80 to 90 cases per day positivity. And this could be achieved because of this hand-holding by the public sector along with the private sectors. And this is what we have to do. what I personally feel is that the main government's role is in the preventive sector, in the primary care and the secondary care. And the public, the private sector should be completely left with the tertiary care. And there the government's role basically is a guarantor and an enabler for the citizens towards the tertiary care. And the government has no role as far as going for the tertiary care is concerned unless they really make a very robust primary and secondary care for the citizens. And that is where the importance of PPP model is concerned, and that is where I must congratulate the organizers of this summit, where they are bringing in this whole private sector to go, on the forefront. So, how are we going, what is getting transformed as far as the ecosystem is concerned? There is a clear shift from the brick and mortar healthcare centers to virtual first care centers as far as the patients are concerned. As all of us are aware today, whenever there is a patient, his family go to the doctor, sit in his clinic for say half an hour, 1 hour, 2 hours, meet the doctor, then the doctor puts it down on paper, everything, then sends him to a pathology center or a radiology center for investigation. Then he comes back to the doctor, shows the reports, and accordingly the medicines are prescribed. Then he goes to the pharmacy, gets these medicines done. So, it's a huge loss of manpower, man hours, and expenses for this doctor. So consumer demands are what is today the healthcare sector is being moved by this consumer demands, and innovation in technology and the enablers. So we have to also thank those, especially the engineering people who are in the computers, in the software creation, who are enabling this healthcare sector to go forward as far as trying to mitigate all the problems that are being suffered by the patients today. So what we have to basically do is, if you see, the pandemic's impact compelled healthcare organizations to rethink, to reprioritize, and re-engineer how we look at today the healthcare sector. And that is what's the most important thing. And then, as I tell in all my talks, that the whole healthcare sector or medicine in India is going to be divided into two parts: pre-COVID and post-COVID. Because everything has changed when COVID has come into play. So, he already spoke to you as far as the Internet of Medical Things. This is a huge thing that is going to come in the future. And it's a worldwide network of interconnected medical devices. Medical devices has come up in a huge way. Very few very few people even knew what a oxygen oximeter, which they put on the finger was before the COVID times. Very few people knew. But today, I think every household at least has that one device which is lying with it. And I think one way, I know it's a wrong terminology, but we have to thank COVID for pushing the healthcare sector into this mode where they have adapted to all these. And IoMT and AI together have the potential to enhance the clinical decision-making process and change the reactive approach of healthcare delivery in a very proactive manner. So this is what COVID has basically taught us as far as this problem is concerned. But there are disruptive technologies which are going to become. And this is what is going to shape the future of healthcare. So there are going to be less invasive diagnostics which are going to come, less invasive treatments. So non-surgical treatments are going to be more and more popular. Patient-facing mobile apps, remote monitoring solutions. No more the patients will have to regularly visit their doctors. They can be monitored from far. Digital platform integration, he already spoke to you of how the government is also helping out in that. Surgical robotic tools that is going to come. Today, I still remember, I'm basically a surgeon. I was a professor in JJ. Around 30 years back when laparoscopic surgery came in, it costed me around almost 25 lakhs to get the instruments. So it was not available everywhere. That was the time, and today, after Make in India has been pushed by the Honorable Prime Minister, today I find that the whole laparoscopic set comes for around 6 to 7 lakhs in India it is. So it is now affordable for every patient, even in the PHC centers, we see that laparoscopic surgery is being done. Similarly, if you see the MRI machines have been started, they have started making it in India. Robotics, recently a company has come out where in India they are making the robotics. So maybe a time may come where every medical college will also be having robotics as far as the patient is concerned to help them. So all these connectivity devices and everything these are the disruptions that have taken place, especially in these last 2 years, 2 years as far as COVID is concerned. But there are challenges also. Everything is not very rosy. These are the challenges which are there. And main thing, if you see, the accountability factor which is there has to be built in whenever we move from one system, what we were used to this system, next system that we are going to see in the next decade, which is going to come forward. So digital culture is the thing which will allow our patients to have affordable and accessible, even from the remotest of places in the country. They'll be accessible to the best of doctors, best of consultants everywhere. So this is the time where we have to also change as far as the healthcare providers are concerned. And digital health care is basically what is going to drive the whole healthcare sector in the next decade. So not only it's a win-win situation for the doctors, where they can use a lot of information which comes to them, ready-made information, so that they can diagnose the patient, but it is a win-win situation even for the patients, because they are going to be able to talk to their doctors 24/7, whatever their problems are, especially in emergencies or anything, and they can be guided. Today, whenever there is an emergency, the basic problem with any patient or their relative is they do not know where to take the patient, to which center to take, depending on the disease. So this definitely will be helped when they go online and they talk, say, to their family physician or to their regular consultant. He will tell them exactly where to go. So it is more proactive, and efficient healthcare delivery will be helped as far as the when digitalization comes into play. But there are 2 keys we require. One is the improvement in technology. Luckily for India, as far as technology is concerned, we are way ahead as compared to, because we have those brains who are helping us, the engineers who are helping out in that. But what we require, being in the healthcare sector, is reimagining the work itself. What we are used to, we have to now try to come to the next era of what we are going to do in the future. And this is there. And this especially happened when telemedicine was made legal and official. If you remember, before the COVID times, even the councils would not allow you to even do telephonic consultations with the patient. It was not allowed. And there have been cases which have been filed against the doctors for even telephonically giving them treatment. But come COVID, and this is what I always say, this is a silver lining to the dark cloud of COVID, where the council was pushed to allow telemedicine, and it has come in a big way. Today I see even family physicians, half their consultations are almost online. Okay, so this helps the doctors, this helps the patients also. So what is telemedicine? Nothing but patient sitting somewhere, you sitting somewhere, the provider sitting somewhere, and you talking to each other without actually physically meeting. And this has got huge advantages. It has advantages to the patients, to the physicians, and to the cost bearers also. So it becomes a huge advantage even to the person, may it be the government, may it be the insurance companies, may it be the company's reimbursement, or whatever it is a huge advantage to them, especially telemedicine. GOI initiative, which I think sir has already spoken about, the NDHM. This is a huge thing that is coming up in the future. I have been involved with this, being in the council as the president right from day one. And let me tell you, it started in 2017. Unfortunately, because of the COVID times, it was pushed a little bit in front. But once this whole platform, just like in COVID, how we saw the CoWIN, today the CoWIN platform is appreciated all over the world. Even when I traveled to the US and I showed them online my CoWIN certificate that I have received the booster dose, they were surprised. Whereas in the US, they were still getting a written paper in which they had written that yes, the booster dose has been given. So this is going to be a huge platform which is going to completely make health coverage efficient, accessible, inclusive, and affordable, and timely also as far as the patient is concerned. So I'm not going to go into details. These are the stepwise how NDHM is going to be launched, As I said, in 2017 it started. It was supposed to have been at present launched completely, but because of the COVID problems, it is a little bit. It will take another 1 or 2 years for this NDHM to come in. And what this NDHM basically does, as I said, as he has already said, that a health ID of every patient is going to be there on that. Now, the biggest advantage as far as the health sector is concerned is, suppose a patient shifts from, say, Mumbai to Delhi. When he goes to Delhi, he does not bring all his papers. But if he is there on this NDHM, all his reports, all his treatments, what he has undergone, what surgeries he's undergone, procedures, everything will be on that. You get it at the click of a button. At the same time, the data is secure, because only if the patient gives you the permission and gives you the key, that number which is there, only then you can access it. But this is going to be huge as far as the future is concerned. Not only that, they have already taken the details from the council. Every doctor will be there on this NDHM. And this is going to help, this platform is going to help in future also as far as telemedicine is concerned. This is the beauty of, this platform which is going to come. I know that the Aam Janta is still not, well versed with this, but this is going to be the future. So, RISE, what is the RISE in on-demand as far as healthcare is concerned? The patient wants to be treated at his convenience, at his own time, and wherever he happens to be. So suppose if my patient, I have operated on him, but he's come from, say Pune, or he has come from, Jharkhand or something like that, and he wants to go back to his place. How does he do follow-up with me? And this is where, this is how I can follow up that patient. And this is going to be anything, anytime, any place. That is going to be the mantra for the future as far as the patient and the healthcare sector is concerned. And these are the basically top trends that are coming in. Wearable, patients on-demand healthcare, percentage and everything has been given over there. Wearable devices, a huge data which has to be collated, a huge data which is going to help our health sector providers in treating the patient in the proper method. And then, of course, artificial intelligence and the 5G which is going to come is going to completely change the way we are going to treat these patients in the future. Patients want everything in the palm of their hands. Today, as you know, the smartphone, it is not only a phone, it is a fax machine. You can go online, you can send your, emails. It is a camera, it is a video camera, it is a calculator. So everything has come in the palm of the hand. So in future also, the patients want everything in the palm of the hands. And this is going to come only when technology is going to help the healthcare sector. So this is just a depiction that just on that one palm, you can see the smartphone is there. So his pulse, his BP, his oxygen tension, his ECG, everything can be recorded, and real time with the help of 5G tomorrow, it is going to be, sent to his healthcare provider, who immediately, tells the patient, yes, something is wrong with you, please do so and so, or go and get your investigations done. So, digital technology, virtual reality, AI, machine learning, robotics, computer machine vision, wearable technology, the genomics is another thing which is going to come in a big way. It is there in the Western countries, but not yet that popular as far as India is concerned. 3D printing is another huge step that the medical sector has taken with the help of this technology. So, and as I said, 5G. So this is just, I have given a little bit details as far as these are concerned. Robotics is something that is coming in a big way. We never imagined when I did my medicine that I could, as a surgeon, I would not be touching the patient. I would not be cutting the patient. I would not be suturing the patient. Today, I can sit in a console in another room and I can operate on this patient. A time will come where I'll be sitting in, or a surgeon will be sitting in Mumbai and operating on a patient who is in Gadchiroli. So that time will also come as far as robotics is concerned. Another aspect of robotics is the bots, microbots, which are going to come into play. And this is also going to be a huge step that we are going to take forward. So wearable techniques, genomics, 3D printing, extended reality, that is virtual, especially in the teaching sector, it's going to come. 5G, digital twins, digital pharmacy is another big aspect which is going. So what is going to happen? This is just a depiction of what is going to happen in the future. The doctor is going to meet the patient online. He is going to ask him questions. He is going to tell him which investigations to do with the help of AI. Those investigations the patient has to do, and with these wearable things, it can be done online, digitally also. Then that is transmitted to the doctors. He tells him what the medicines to take, which the doctor transmits to the pharmacy, and the pharmacy reaches it to his residence. So this is going to be the future. You see, the drone is doing that, and already in COVID, we found in the remotest of areas, the drones have supplied the vaccines over there. So this is already in place. So this is what is going to happen as far as future is concerned. So this is just a short 1-minute video that is there. We are doing endoscopies, we are doing colonoscopies, gastroscopies and everything. All that will go off in the future. The pill cam is there. You just swallow, the patient swallows the pill and it moves all around in his intestines, and on the way it's taking photographs, and that photographs is being sent to the computers. Not only it is sent to the computers, but whatever disease is there at what level. Today, as you know, with gastroscope, you can reach up to the duodenum, with colonoscope, only the colon, but the small intestines cannot be seen by any scope. This pill cam will see this small intestines, and if there is some lesion, as you see over here, this lesion is there, it takes the photographs of the lesion, sends it to the computer, and this becomes very, very easy for the doctor to treat in the future also. Microbots is another thing which is coming, where, you know, in the old, there was a movie where a scientist had a bleed in his head, when he had a head injury, and they sent microbots over there, where they traveled over there and took care of that bleed. Same thing has come into play today. That was imagination. Same thing is come, especially in cancer. This is a huge thing which has come, because what these microbots do is go locally and treat that cancer. Today, when you are taking radiation, today when you are taking anti-cancer drugs, your whole body is affected. Whereas in the microbots, if it goes to that particular target cells and goes and gets attached to the target cells and releases those medicines, that will be only for that region, and the rest of the body is safeguarded from the bad effects of these anti-cancer drugs. So this is what, and this is for all the hospital CEOs who are sitting. This is how your hospital will look in the future. Today, if you see the hustle bustle in the corridors, when you are going to any hospital, you have the sisters, the ward boys, everybody going, it will be empty. The patients will be on a monitor everywhere, and the whole monitoring will be done by the doctors who will be sitting in a room and deciding what to do for this patient. So, lot of technological things are going to come. The only thing is a caution that technology is a great servant, but it is a terrible master. So let not the technology master you, but you see to it that you are the master of that technology. Do not lose the human touch between the doctor and the patients. Use technology to augment your services towards the patient. So thank you very much for I hope I have kept to the time. Thank you very much.